Hey guys, this is Manu, Kalia, physical therapist and Ayurveda herbalist. So today I'm going to answer a question that a lot of you guys have been asking, and also my patients ask me, is what's causing pain on the inside of my knee, or a medial joint line pain. So just to show you and share with you some of the common structures that are on the inside of the joint that can be causing knee pain. Okay, so looking at the knee joint, and especially on the inside of the knee joint, there are quite a few structures, from the meniscus to the ligaments to muscles, tendons that are supporting the inside of that joint or helping the joint function properly. So if those are affected, it can result in pain anywhere along the inside of that knee, sometimes even radiating further down. Okay, so some of the common structures that can cause pain on the inside of the joint are. So I'm going to bend this knee so you guys can get a better look at this. So if I look at the knee joint, here's the joint line, okay, where you have the top bone, your femur, and your bottom bone, which is the tibia, the meeting points of that, okay. So along the joint line, you're going to have your medial collateral ligament is going to sit here, which basically holds or supports the inside of that knee joint. Okay, which essentially joins the top bone to the bottom bone. Then you have your meniscus sitting on your medial meniscus through here, which can cause problems also. And your meniscus also has a ligament, a coronary ligament that holds it together through here, which can be causing problems. Okay, so meniscus, coronary ligament, your medial collateral ligament. Of course, your ACL, PCL, which are deep within the joint, can have problems too, which can cause some of the referral stuff, but less common for stuff going on through here. And then you have your other soft tissue structures. So your adductors, a lot of the other muscles that are coming through this region. Your pes and serine attaches right through this region. So these are the stabilizing structures for the inside of the joint. And if there's a problem with them, or there's excessive stress on those structures, we'll refer pain. And let's not forget one of the common things that people often complain about when they have a lot of knee pain on that inside part is arthritic problems. So there's arthritis or degeneration of that joint through here. You're going to quite often get pain through this region too. Okay, so if there are, for example, your MCL or your medial collateral ligament, if there are minor tears in it, or there's a strain which is set up an inflammatory process causing adhesions or scarring of that ligament, every time there's strain or stretching of that ligament, you can have pain too. Same with the meniscus. If there are tears in the meniscus, or for that matter, if there's been an injury to the coronary ligament, you can have pain, clicking, popping, all those sensations, possibly even swelling along the joint line too. And if arthritic problems, again, you might have restricted mobility or range of motion, and any kind of compression when you're standing and walking, putting pressure on that joint will often cause pain through this region too. Now, some of these problems, quite often the problems have to do with the mechanics along the whole chain. So what's happening at my foot if I don't have enough arch support, if I have flat feet, or I'm pronating too much, and my knee tends to drift in, the valgus load on the inside of the joint will also affect what's happening here. And for that matter, what's happening at your hip, your pelvis, your hip, and up the chain. So if the mechanics are off through here, it's going to impact what's happening at this joint too. So you really have to look at above and below the joint always, affecting the mechanics, if you truly want to address the knee problem properly. Okay, whether you're a runner and you're getting a lot of joint line issues, whether outside or inside, or for that matter, or other kind of athletes too, or for day-to-day activities such as walking, squatting, going up and down stairs. So you really have to look above and below the chain, whether there are mechanical issues, whether there's weakness of the local muscles. Again, above and below the joint. The quads are weak. These are the guys who sit at the top of the knee. Your hamstrings, back of the knee, they're supporting this part. Your adductors on the outside, right? Your IT band structures inside are your adductors. Your IT band on the outside. So all these structures are giving you stability. And even your calf, which attaches above the knee here, your gastrocnemius, is providing some stability and some function for that knee. So you really have to look at all of those structures and see where the problem is, whether things are tight, whether things are weak, whether there are mechanical issues, whether there's load sensitivity, doesn't tolerate loading, or activity sensitivity, too much walking, too much squatting, too much kneeling aggravates the symptoms. Okay? And then you have to devise your treatment based on that, whether I need some kind of hands-on massage, cross-friction massage, or other therapies, whether you do some strengthening exercises, whether flexibility exercises. So I have a lot of other videos I've done in the past which I've gone through some of the things in terms of some massage techniques and some strengthening exercises too, which affect certain parts of the knee and also certain muscle groups. Oh, one other thing that I forgot to mention, and I should clarify too, is that in addition to some of these structures that I mentioned, along the inside of your kneecap too, quite often people get problems. So patellofemoral problems, which are usually on the outside, but I find you can have problems through here too. Your quadricep expansion, which is the connective tissue or fascia or the tissue that comes and inserts through this region, and also through your patellar tendon, which is right here. This is the base of my kneecap right here, and the patellar tendon will attach here. So you can have problems along this region too. If things are adhesed or they're stuck and you have scarring or thickening of this tissue. So you have medial, not quite medial joint line pain through here. You might be feeling pain all along this border.